I know you are thinking about studying abroad, but the health insurance cost can make a hole in your pocket. Well, to be honest, that's completely normal. I am Simran, co-founder of Epicred. Today, I am going to tell you everything about international student health insurance in the USA that a student should know. And by the end of this video, you will know how you can get a ACA compliant or AC comparable plan that actually works for your university. First of all, you cannot ignore health insurance in the USA because a single doctor visit can cost you hundreds of dollars. An ER trip can cross $1,000. And what about being hospitalized for a few days? That can easily go over $10,000 because of the medicines, routine checkup, mental health care, and a lot more. Without insurance, your tuition and living budget could vanish in just one single accident or illness. So first, let's understand how does this US healthcare actually works. The US healthcare system is very different from what we are familiar with in India. It's mostly private. Hospitals, doctors, insurance companies, they all have a big role. There is no concept of universal coverage, that is, you will have to get your health insurance on your own. Most of the Americans usually get it through work or public programs. But as a student on a visa, you will not qualify for all these. So what does that leave you with? Mostly the university-sponsored health insurance or the private insurance. We all know that university plans are the safest option, but they are too expensive. Whereas the private plans can be much cheaper, but make sure that they are accepted by your university. That is, it should be ACA compliant or comparable. ACA stands for Affordable Care Act. It sets a basic rule for what a health plan should cover in the US. An ACA compliant plan will always include: first, emergency services; second, doctor visits and hospital stays; third, prescribed medicines; fourth, preventive care like vaccinations and mental health support. Please note that most of the universities require the health insurance plan to be ACA compliant or comparable. If it's not, they could possibly force you to reject it and force into their costly plans, and that can potentially burn a hole in your wallet. So how to choose the plan wisely? So I always tell the students, don't look at the price. Make sure to check if it covers the doctor visits, prescription, specialist visit, and the preventive care. Some cheap plans might skip these essentials, but that can be risky while you're staying in the US. But the good thing is we can make the things easier for you. At Epicred, we match you with the ACA compliant or comparable plans that your university will also accept. Our plans will cover everything that you actually need, be it doctor visits, hospitalization, medicines, preventive care, and much more. So you'll get all the facilities without the expensive price tag that is given by the university. And we already know which plans your university accepts. So there is no chance of rejection and you will save a lot in the longer run. You can check a lot of students have received their health insurance through Epicred. I think it's really worth spending some time upfront to get the right health insurance. You should not wait until you reach US and then you realize that a lot of your peers have already taken a health insurance that is accepted by the university, and that too at a much lower cost. So that's all from my side, and if you need any assistance, you can reach out to our expert counselors. They'll guide you through the process. Do like this video and share it with your friends who are planning to go to US. So thank you so much for watching the video. See you in the next one.